Hello, everyone, and welcome once again to the Only You. Vince here at the Only You in Solitude Studios, and of course, Dr. Patino in his office. Dr. Patino, happy belated birthday. You celebrated your birthday recently, and I know your family's off traveling, which is a little bit of concern because basically, when we think about the topic we're discussing, which is the new variant of the virus. But first, how are you doing?
I'm doing okay. I stopped counting my birth dates because there's a time in your life when you have to stop counting how many years you have accomplished and start counting how many years you have left, right? That makes me feel younger in some ways. Yes, I mean, in Mexico, we have this word that we use, this phrase we use when we keep going to the same thing over and over and over again. And is that we have this tendency to refry the beans, right? So, so we have beans and then we refry them the next day. And every time you refry them, they actually taste better. So if anybody wants to try this, they should do it. But this whole issue with the virus and the vaccine is starting to sound like refried beans, right? And today we're going to talk a little bit of Omicron, and of course, my wife and one of my daughters are traveling overseas, and of course, we all have concerns. But let's be realistic. We have had concerns for the last 2 years, right? And thinking positively, I have to force myself to re-understand, right, that we have learned a lot about this stuff.
Mm.
So today, when we get bombarded with the Omicron label, right? First, before we make any judgments and we make any decisions about the new virus, which is not a new virus, it's a mutated virus, we have to recognize what do we have today that we didn't have in December of 2019, right? And we have a lot of stuff. I mean, we can go over some of that in just a minute, but we have to take a deep breath and know that we have tools today that are a lot more useful, right? That are a lot more protective. That unfortunately, the tools have become politicized to the point of deciding who the good guys and the bad guys are,
Mhm.
right? So we need to be empathic to our fear and to the fear of those who think differently, but recognize that we have something in common, It is called fear. And we're not going to fight fear and uncertainty by fighting with each other, but by being empathic that we have different ways of managing our fear. Some of us manage our fears protectively by getting vaccines and boosters and wearing a mask and by keeping our distance like we've been doing for the last couple of years. And there's other people who manage their fear by being angry,
Mm.
right? And the problem is that being angry is not protective. Being
Question.
angry isn't a problem solving task.
I have a question because recently I was at a place, my other place of work, and a gentleman asked if I was vaccinated. I said, yeah, through all three, and he had this look of horror on his face, and then told me a story of him having COVID so bad, not enough to go to the hospital, but he couldn't breathe. Went to his kitchen, cooked up some fennel seeds, and within 20 minutes was cured.
Mm.
Um, uh, you mentioned that there's the protective, there's the anger, but it seemed to me like his was ignorance. There's a third thing of just pure ignorance toward the realities of such things.
Yes, I mean, and you know that I do research, pharmacological research, and in our research, we're always comparing new things, new medications with placebo, right?
Mm.
And we compare to placebo because we want to make sure that whatever we're trying is better than placebo. So there's placebo is a powerful distraction for some people, right? Because what they're saying is, I took whatever, honey, or I don't know,
Fennel seeds.
whatever, and I got better. And the assumption is that there's a direct relation between what they took and a cure, right? The problem is that they start advertising the cure and people start taking it, right? And we went through this process with a number of different substances for the last couple of years, some of which have been scientifically tested and proven to not be any different than placebo.
Mm,
So, uh, the only thing that I have to say is that if you take whatever you take and you feel better, you may have feel better even if you didn't take it, right? Now the problem is the ones who took something and didn't get better,
mm.
and it got worse, and ended up being hospitalized, and then they died. And the problem is that the same person who had that conversation with you about minimizing the seriousness of COVID and taking something, right? Then you're gonna they're gonna argue with you about why that people died in a way that it would not make the virus responsible for death, right?
I had a friend die a week ago, and he was, of course, it affected his lungs. And I mentioned it to somebody who I know is very much a denier, and I said, "Yeah, he died of the pneumonia caused by COVID." And they immediately snapped back. Well, then it wasn't COVID. It was something different. I'm like, no, COVID is what actually helped cause this. It was really interesting. Very, very defensive. Would not accept the realities of that whatsoever. And he, in his own posts, pre-mortem, he said, "Look, I'm dying of COVID." And even as some of the friends, one of the friends I was talking to who knows him, denied it. Even in the end, he goes, "No, that wasn't COVID. It was pneumonia." And they made no correlation, but just like the gentleman did make the correlation between the cure, this people aren't making the correlation between the cause of death.
Yeah, but the question that really needs to be asked, Vince, really has to do with why the need to justify irrationality, why the need to be defensive, right? And again, I get back to the issue of that's a way of some people managing their fear, right? I mean, negating something, ignoring something, or avoiding something is a defense mechanism too, right? So by projecting it and saying that what you say is not true, you're the one who's wrong, it's no different than somebody who's paranoid who's telling you you want to hurt me,
Hmm.
right? When there's no rational evidence that you want to hurt anybody, right? So that's how irrationality and paranoia starts. And once you get convinced that there's something out there that is trying to target you, right, then you're going to have to be defending that rationale.
Hmm.
And I think it becomes important that people take a step back. And I think that those of us who are taking protective measures, we need to extend the hand, okay, on facilitating those people who don't know they're afraid to recognize their fear, right? Um, so the something that I learned long time ago, in long time before COVID, is to not argue with people who disagree with me, because I don't want to be in a position of having to defend my position, right? Because that creates more resistance. So all I can do is to offer my hand and my ear and say, I'm here. I can listen to you. I understand your concern. And that's as far as I can go. Because it's not my job to convince people that the way I think is the right thing, right? But I do have a responsibility to offer people options. So when we talk about Omicron, for example, the only thing that we have to offer right now is uncertainty.
Hmm.
There's a lot of stuff we don't know, right? I mean, we don't know if it's more virulent or it's more intense in terms of how it attacks the body than the Delta variant that we just went through recently. We don't know if it's going to be resistant or somewhat more resistant to the vaccine. We don't know if it's going to spread as quickly as Delta did in India, for example, when it was catastrophic. We don't know if it's going to evade antibodies or not. It's a lot of stuff we don't know, right? So what do we know?
I'm not really sure. Other than, of course, we have this disease that's out there. We don't know much about this new variant. Like you said, it could. We discussed it before the show. It could burn out. It could be. incredibly dangerous? We don't know because it's so little information. But we do know is if that we are vaccinated, if we use our mask, if we socially distance, all the things we've been doing since the beginning, it will decrease our chances of getting ill. If we're vaccinated and we get ill, it will decrease our chances of dying from the disease. Correct?
Yeah, well, yes, and and it gives us something objective that we can act on, right? We can objectively wear a mask. We can objectively distance ourselves. We can objectively get a vaccine and a booster, right? And the third one in particular, the getting the vaccine and a booster, I think is misunderstood. I think that we have failed to some degree on delivering the important message of what the vaccine is for,
Mm.
right? Because we have to understand, and I think that Omicron is kind of like the final door that is telling us COVID is here to stay. COVID is not going anywhere. We need to think of COVID as we think of the flu, right? And I
Mhm.
was discussing some statistics about the flu from 2010 forward. You know, we've had years where we had 12,000 people a year dying from COVID. We have years like 2017, 18, we have 52,000 people. So anywhere from 50 to 150 people per day die from the flu in the United States, with 21 to 50 million people getting the flu per year, right? And we get a vaccine for the flu, and every year we get a vaccine again. Technically, what we get in the next year is a booster that is prepared for the next variant that is presenting itself, right? So we need to get used to the idea that COVID is here to stay, and the boosters, right, are effective on protecting us from the virus in general, maybe not to the same intensity. So that's why we have to get another booster the following year. I don't think we know exactly how often we're going to get this, but it's looking like 6 months to a year probably. So something we can objectively do right now is that if you're not vaccinated, get vaccinated, right? Why? Because your risk of getting this variant or any variant is a lot higher. In the United States today, we only have about 63% of the population fully vaccinated,
Wow.
with some states higher, some states lower. Arizona, for example, we're like at 53, 54%. That means that about half of the population is not vaccinated, right? So, what's the problem with not being vaccinated at a high level? The problem is that the opportunity for the virus to replicate and infect, and the opportunity for the virus to mutate, to change into a different variant, is higher, right? I mean, eh, um, it's not rare that some of these mutants variants are coming from other countries that don't have as high of a vaccination rate,
Mm.
right? But then they start migrating, and the vulnerable people perpetuate that. So the idea of herd immunity is that we have enough people, so there's less opportunity for the virus to replicate and change, right, and to adjust.
Well, because a virus needs a host, correct?
Exactly. The virus can't live in nature, forever. So if there's not enough people to host the virus disappears and dies,
And
right?
if you're vaccinated, that host is less hospitable, correct?
Exactly, because you have antibodies, and the antibodies are going to protect you. Of course, they're going to be people who are going to get breakthrough infections like it happens with the flu. But the purpose of vaccination, both from the flu vaccine and the COVID vaccine, is to prevent serious illness and death. Is not to prevent infection
Mm.
100%. Even though it reduces the risk of infection, the ultimate goal is that you don't die from it.
See,
But
I think you're right. I think that's probably the least communicated point and the most important point. People really think that it's a cure. That if you get it, you don't. And if you see someone who gets COVID and they've been vaccinated, it supports their evidence, at least their fact based, quote unquote, fact based evidence that a vaccine is useless.
correct. So and we hear this in the news all the time. Somebody got vaccinated, got a breakthrough infection, and the answer from some in the media is, "You see, the vaccines don't work."
Mm.
No. I mean, I had one of our nurse practitioners in the hospital got infected last week. She's vaccinated, boosted, the whole works. She had a breakthrough infection, but it was moderately severe. She didn't have to be hospitalized. She didn't need oxygen. She rested at home for 10 days and she's fine, right? That is, I mean, and she had some risk factors that could have made her vulnerable to a more serious infection. So you can say that that's a successful vaccine, right? But people are translating if I get infected while vaccinated, the vaccine is not working.
Mm.
If you're vaccinated and you don't go to the hospital and you don't die,
It worked.
it worked,
It worked.
right? And
I think.
some people may say, well, if I'm not vaccinated and I get COVID, right, and I don't go to the hospital, I don't die, it means that we don't need a vaccine. That is not true because now you're becoming a perpetuator of the virus by your hosting, right?
Mm. I think we made the analogy before the show of, if you don't want to get in a car accident, don't drive. But if you are going to drive, in our case, we're going to be out there in society. Um, Make sure you're vaccinated and have a mask, which would be the similar to using your seatbelt, having your airbags on. It doesn't mean prevent you 100% from getting into a crash, but if you do, it's certainly going to help significantly.
Yeah, in fact, wearing a seatbelt and having airbags reduce the risk of you dying, right? So you're not gonna be thrown out of the
Yep.
window, right? And you're gonna stay in your seat, maybe with a few broken bones, and you're gonna be in pain, but you're not gonna die,
Hmm.
right? So it's the same thing with the vaccine. No, what I think is very important is that, and we've talked about this before, we have to proactively use the measures that are available to us, but also be prepared. What if in 2 weeks somebody tells us Omicron is different, the vaccine is not working as well? You know, it reduces the efficacy from 95% to 75%, which is still pretty good, but a little higher risk. Well, maybe we need to start using the mask more often,
Mm.
maintain our distance, not go to places where you can be exposed. We should know that by now. We shouldn't be talking about mandates, you know? Oh, the government wants me to wear a mask. Well, not necessarily. I think that you should be wanting to wear a mask because it's good for you, right? You should try to avoid going to too many places where there's a lot of people unmasked if you're concerned about your vulnerabilities. Yes, I do agree that we have to have choices, right? I do agree that people should have the ability to choose, but they have to choose rationally. They have to choose with information that is valid, rational, scientific information and not gossip, right? Not, I think, because I read it in Facebook. I think because I heard it in the news. Yeah, what are the facts that are supporting your information, right?
Yeah, but
Eh,
we've talked about this before. People are saying the facts are incorrect. One media source says A, the other media source says B. Their paradigm has them choose media source A as the truth, the true facts, while media source B are no facts at all. And if a person does not accept any new data, they can't possibly change their mindset. It's just can't be done, right?
Well, it's turned political, right? And unfortunately, as we talked before, there's some people making a lot of money out of this,
Hmm.
right?
And who would that be? Actually, let's talk about that a little bit. Who would those people be who are making money?
Well, media in general, right?
Okay. Yeah.
Um, and I think that even those who are presenting uh, facts that are more scientifically based, they present it with a tint of fear, right?
Hmm.
If I scare you enough, you listen to the commercial, right? And if I scare you enough, more people will buy my program. So we need to understand that this should be an issue of a patient and a physician. I mean, my ideal situation is people being afraid going to the doctor or doing a telemedicine visit and discussing rational facts with their personal physician. And if after having a conversation with the personal physicians, they decide, I don't want to get the vaccine. I don't want to wear a mask. That is fine, but you're consciously and rationally accepting a risk,
Mm.
right? And you make yourself responsible for that risk. The problem is that when you listen to the media, whether it's on the right, on the left, on the middle, the up, down, whatever it is, and the impetus is to sell you something and you believe it, you're irrationally hurting yourself. And at the end of the day, this is about you first, because you can only help people be safe if you're safe, right?
And what do you say to other medical professionals who just aren't there? I admittedly have a dermatologist who, when I mentioned I had friends die from COVID, he was shocked. He says, "Well, they must have been very, very old and frail." I'm like, "No, they were not." And he just kind of stared at me for a while. I'm like, "Wow, he doesn't believe, but he is a medically trained physician." What do you do with that? I mean,
we, we,
I mean,
we
I just, because people, especially certain age groups, a doctor is the end all be all.
yes, I mean, fortunately, most physicians will be well informed, okay, and they will provide rational, scientifically based information that the patients can use to make their choices. I mean, you and I have had this discussion before. I don't believe that physicians should tell people what to do. I don't think it's our job to tell people you have to take an antidepressant, or you have to do this, or you have to do that. It's our job to tell the patients this is what I think the risks are. On the positive side, the benefits; on the negative side, side effects and potential problems. Okay, this is the risk of doing nothing. And what is your choice? Because there's a risk of doing nothing, right?
Mm.
But I think that that conversation needs to happen, and it should not be happening in the media. It should not be happening because you're afraid. It should be happening because you're hopeful. You see, when a patient goes to the doctor and establishes a doctor patient relationship, should be a relationship of hope, right? So, even in those cases in which a patient comes into the emergency room with appendicitis, right? It is our responsibility as physicians and surgeons to say, listen, this is what we see. We have an ultrasound. You have all the symptoms of appendicitis. It's not bursted. You need to have your appendix removed. This is the benefit of removing it. This is the benefit. This is the risk of not removing it, right? And this is the risk of removing it, meaning bleeding, infection, anesthesia, whatever, right? At the end of the day, it's the choice of the patient.
Mm.
I mean, some patients will say, I don't want to have surgery. And you have to tell them, well, you may die, right? Or you may get so sick and so unconscious that we may have to use substitute judgment after you go unconscious with your family to decide what to do. But I don't think that we can operate on that person when the person is rationally choosing to not have surgery. I mean, as a psychiatrist, I get called often to do psychiatric evaluations on patients who don't want to have dialysis, right?
Hmm.
And the nephrologist says, well, that's not rational that you don't want to have dialysis, and the patient is competent to make that choice, right? Now, what happens when the patient gets into uremia, becomes unconscious, goes into a coma? Well, they're probably going to give him dialysis because the family wanted dialysis, but the family says no, you have to go to court. I mean, we have to respect individual decision making, but we are obligated as physicians to provide the risk benefit ratio and the risk of doing nothing, right? For the patients to make that discussion has moved away from the doctor's office into media,
Hmm.
right? So the people are arguing, you know, the why I shouldn't have it, okay? Why, and then other people arguing why you should have it, and nothing happens. I mean, 37% of the population in this country is unvaccinated, right?
Which is sad for a developed country.
Well, it's not only sad; it's risky,
Hmm.
right? I mean, we getting more than 700,000 people dead in the last 2 years, right? Um, have we learned anything?
I know some people, again, continuing, and I've been very unfortunate. 19 people I know have passed in the last 22 months. Not all from COVID, but a
Mhm.
good chunk of them have. And it's interesting when someone's never had any, direct effect of it, they will deny, deny, deny. Question though, with this new Omicron, what do we know about it? As you said, it's brand new. We're just getting some information, but what do we know? What does it look like, at least at this point, with the data we have? The concerns are concerning the specific variant.
I mean, we are probably a couple of weeks away from hearing from scientists in terms of the questions that everybody wants to know, which is this going to be are the vaccines as effective? Are they responsive to the antivirals we're using? Is the infection more severe, less severe? We don't know any of that. What we know is that there are mutations in the spike of the protein where the protein attaches to a tissue, so it infects the body, right? Some of those mutations are present in the A variant and the B variant and the Delta variant, right? So, but they notice a number of them. So, this makes it a different avenue for the virus to attach to the body. The significance of that is now well known,
Hmm.
right? So we may hear in a couple of weeks, don't worry, it's not much different. Or we may hear this is catastrophic. We need to create a new vaccine, a new booster, whatever. But for the right now, all we know is that the tools we have, which is the vaccine, and if you're already vaccinated, a booster, if we know that you can use masks, if you can use social distancing, you can take the personal responsibility of saying, I'm going to take those steps and I'm going to prepare myself mentally, right, for the best or the worst, and I'll cross that bridge when I get to it. But we cannot just get into a bubble of misery, going in circles chasing our tail, saying the end of the world, right? Now, I can assure you there's going to be some people who are going to be doing that because there are people that are naturally and genetically anxious, and there are people who are looking for how can we make more money out of this, right?
Yeah, indeed, indeed. I've heard some people ignore it that it's occurring. Other people responding very aggressively, I guess, or more. Some would say neurotically. I don't really consider that neurotic. I think it's just our methodology about this variant. We do know, as you mentioned, all the things that we have been doing do work. So to continue to do them is probably the best. Um, any other advice for people out there? Just again, so let's assume you are concerned about this. You deal with mental health all the time, and people responding to information. What would be the advice to the person who's listening to the show who is terrified of the Omicron virus or
Well,
variant?
if you're terrified to the point that is paralyzing you, I will suggest that you get on the phone and talk to someone, right? Have a conversation with somebody you trust that is rational, that has some medical knowledge or some therapeutic skills that you can have a conversation with and express your fear. Don't call someone to convince them that your fears are real or based on scientific fact, because we don't have the scientific facts right now. But I do think that right now is a very critical time because of the holidays, right?
Mm,
And what I think is pretty difficult for people is that we were hoping that we're getting beyond the Delta variant, and then we get hit with this, right? That is terribly demoralizing. And for some people, it's like post traumatic stress disorder, right? It's like, here we go again into the trauma bubble of misery. We don't have to do that. We don't do that with the flu, right? We don't know if the flu is going to hit in 2022 51 million people or 12 million people, right? And the only tool we have is to go get vaccinated, right? In some countries, they wear masks too. You see, the mask is a new thing for us, but if you go to China or you go
oh yeah,
to the East, they use masks all the
all the
time.
time. Anybody has a sniffle, it's just social protocol for you to protect others and wear a mask.
Exactly. So we need to understand that this is not the end of the world. But I do think that people need to be cautious on who they socialize with during the holidays
Mm,
until we know more about this variant, right? Again, it may be a bust, It may be that it's not that significant of an issue, or that we get good protection, or it can be that the vaccines are not going to be as effective, so we need to be more cautious. So we start being proactive, right? I mean, if you're invited to a get together, you want to know the people who are going to be there are vaccinated or not. Okay, you're going to have to decide as a family if you invite to your home people who are not vaccinated.
Mm.
And I can assure you, because it happened during Thanksgiving, all kinds of conflicts, with families saying we only
Oh
invite
yes,
vaccinated ones and not the non-vac. You probably had to deal with that yourself,
I
right?
did. Still, I still am actually. Yes.
So we need to understand that this is not a personal issue. This is a health issue, right? This is an issue of making sure that we don't expose other people, right? And as we discussed in other programs before, I can only control what I do. No? I have to wear a mask in the hospital every day, right? Uh, and I wear my mask in the hospital every day. I'm not going to be getting into a discussion about is it proper to wear a mask or not, right? And not, I am vaccinated. I had 3 vaccines, right? I know that I have better protection than most people and most of the patients who are there. But I have to be responsible, right? On making sure that if I'm carrying the virus, even if I don't have any symptoms, I don't give it to other people,
Mm.
right?
I think that's something to really consider during these holiday times. And we have that phrase that is often used, peace on earth, goodwill toward men. Having goodwill this year might mean staying home, staying away
Well,
from
and,
some
and,
people,
and
right?
and you know that I'm not hyper religious, but I always ask that question: what would Jesus do?
Absolutely.
I mean, I grew up in the Jesus environment, Catholic and all that, but I always have to ask people, what would Jesus do? Would Jesus wear a mask? Probably. Will Jesus get a vaccine? Most likely.
So I think you just saw. I don't know if you want to respond to that. We got a live comment. Do you see it there?
Let me go back.
I can read it to you. It says Dr. Rajan Hodgkinson, chairman of the Royal College of Physicians and Surgeons on COVID, quote, this is the biggest hoax ever perpetuated on an unsuspecting public. From Tyrone Jackson.
Okay. I mean, I can answer the question. Just look at the numbers. Look at the statistics. Um, Almost a million people dead in the United States. 5 million people dead in the world. Um, we have some responsibility of helping decrease this. Um, I mean, I understand, the quotes, which I don't even know if they're true or not,
And may have been
but
taken out of context, which is typically what we
well, well, but that's not the point. The point is we need to stop being afraid. I mean, if we're utilizing quotes to hide our fear, we're not gonna get out of this, right? So I think that the only thing that I can tell the Tyrone is, if you're afraid, just take a more positive step,
Yep. Because
and we're gonna leave it there.
also a lot of these quotes may have been done before he had additional data. I know when it first started for myself, I questioned it as well, and then I had some friends pass and saw some people get sick, and it really definitely changed my point of view. So, anyway, once again, appreciate your time. Again, folks, try to do the right thing during the holidays, and we'll see you next week.
Hey, thank you. It was a pleasure being with you. We'll see you next week, man. Take care.
Take care.
Bye bye.